Okay, so you're finally heading home from the hospital.
Yeah.
That first breath of fresh air outside, it feels incredible, right? Real relief.
Oh, absolutely.
But then, reality hits. You've got this pile of papers, discharge instructions, maybe a bag full of new prescriptions,
Yep.
and suddenly that recovery journey feels less about just resting and more like, okay, now what do I actually do?
That feeling, that uncertainty, it's so common, and it perfectly captures something really important. Healthcare isn't just the time you spend inside the hospital.
Right.
It's fundamentally about what happens, once you walk out that door.
Absolutely. And that's exactly what we're diving into today. We've gathered some sources that look at healthcare quality from, well, a couple of key angles. There's the big picture stuff, the rigorous standards that hospitals and institutions aim for.
Right, the system level.
Yeah. And then there's the really practical, sometimes life-saving steps that you need to take once you're home, especially around medications.
Yeah, we've been digging into info from global and national accreditation bodies, names like Joint Commission International, JCI, and India's NABH, the National Accreditation Board for Hospitals and Healthcare Providers.
Okay.
Plus, we found insights from a consultancy that's really involved in the whole hospital ecosystem, and maybe most critically, some really practical guides focused purely on managing your meds after discharge.
So our mission here really is to connect those dots. How do those high-level institutional standards for quality, how do they actually link up with the day-to-day challenge of, well, staying healthy after you leave the hospital?
It's about seeing the whole picture of quality care, from the hospital's big systems right down to your personal routine at home.
Exactly.
So maybe let's start with those institutional efforts, the ones aimed at ensuring quality and safety, specifically healthcare accreditation.
Okay. Yeah, you mentioned JCI and NABH. What exactly are these organizations? What's their role?
Think of them as like the standard setters and the evaluators for healthcare places. JCI, that's Joint Commission International, it's seen pretty widely as a global leader.
A global leader.
Yeah. One source mentioned they set really rigorous international standards for, well, everything from patient safety procedures to controlling infections. Hospitals around the world actually volunteer to meet these standards.
Wow, okay.
And their reach is huge. We're talking over 70 countries, more than 1,000 accredited or certified programs, hundreds of experts involved. It gives you a sense of their scale.
That's massive. And NABH, you mentioned that one too.
Right, NABH. That's the National Accreditation Board for Hospitals and Healthcare Providers. It's part of the Quality Council of India, focused specifically on healthcare organizations within India.
Okay, so country-specific then.
Exactly. Its structure is really built around understanding what consumers need and setting clear benchmarks for quality and service within India's healthcare system.
Okay, so they're setting a high bar. Why would a hospital go through what sounds like a really demanding process? What's the payoff for them?
It is a huge commitment, no doubt. But the sources suggest the benefits are pretty substantial. For the hospitals themselves, it acts as a powerful driver for, internal quality improvement and really boosting their patient safety measures. It gives them a structured way to measure how they're doing, assess it, and then keep improving.
So it helps them get better internally. What about how others see them, the outside view?
Yeah, good point. The sources had testimonials from hospital leaders, and they really highlighted those external benefits too. Accreditation is definitely seen as giving a competitive edge.
Right.
It signals a serious commitment to quality, which can really strengthen the community's confidence in them. It also helps with risk management, reducing potential problems.
Okay.
And several leaders mentioned how the whole process helps organize and strengthen their patient safety efforts, really building a genuine culture of safety. One even called it an incredible team-building exercise.
That makes sense, actually. Getting everyone aligned on such high standards must take a lot of collaboration.
Totally.
Can you give an example? How might one of these standards actually show up in a way a patient might notice or benefit from?
Sure. JCI, for example, has what they call international patient safety goals. These target specific areas where things can often go wrong in healthcare.
Okay.
So a standard might focus on, say, accurate patient identification, making sure staff always double-check who you are before giving meds or starting a procedure. Seems small, right?
Crucial.
Absolutely vital for preventing errors. Or standards around making sure caregivers communicate effectively with each other or preventing infections from surgery. That's the kind of practical, systematic improvement accreditation tries to embed.
It sounds really complex, though. I imagine hospitals might need some help navigating all this. Are there companies that specialize in helping them achieve these standards.
Oh, for sure. Our sources mentioned a company called Supreme Medic Consultancy as an example. They seem to operate right in this space.
Supreme.
Yeah. They offer support across the board for hospital development operations. And they specifically list services for NABH accreditation support.
Oh, okay.
So it shows there's this whole support industry, really, dedicated to helping facilities not just build hospitals, but build them to meet and maintain these high-quality benchmarks.
Right, helping with everything from the initial planning, the day-to-day running, getting the right staff and gear.
Exactly.
And making sure they hit those crucial accreditation targets.
Precisely. It's all about creating and sustaining a place where quality and safety are just baked into the way things work.
And I guess for you, the listener, knowing a hospital is accredited by a group like JCI or NABH, it gives you some insight, doesn't it, into how committed that place is to meeting established quality and safety benchmarks.
It does. It's definitely a signal, a layer of assurance that they're aiming high.
Mm-hmm.
However, and this is where we really need to connect the dots back to the personal level, a hospital hitting the highest standards inside its four walls, that's only part of the health story. What happens after you walk out that door? That's just as critical for your recovery, for your long-term health.
Okay, and that brings us squarely to that really serious and maybe often overlooked issue. Sticking to your medication plan once you're back home. The sources really hammer this point home.
They really do. I mean, one U.S. source had this absolutely stark statistic. Medication non-adherence people not taking their meds as prescribed after the hospital, it contributes to something like 125,000 preventable deaths every year, just in the U.S.
Wow, 125,000 preventable deaths. That's huge.
Yeah.
It really makes you realize this isn't some minor detail we're talking about.
Not at all.
So why? Why is it so hard for people to just take the medicine they're given?
Well, the sources from India and that Lifelines podcast content, they give some really common, very human reasons. Sometimes, people stop just because they start feeling better.
Right, you think, oh, I'm cured now.
Exactly. Or they think the hospital visit itself fixed everything so the meds aren't needed anymore. Others just feel overwhelmed, like there are too many tablets.
I can see that.
Or they're bothered by side effects. Sometimes it's a lack of clear understanding about why they even need the medicine in the first place, or they forget to pick up the prescription. Or, again, just thinking the hospital treatment was the complete cure.
Those reasons are so relatable. After being sick, being in the hospital, you just want to feel normal again. And yeah, a pile of pills can feel like a burden.
It can.
But the message from the sources is crystal clear. These post-discharge meds, they are not optional.
Not even close. They're presented as absolutely essential parts of your recovery plan. The sources really warn strongly that stopping them early or not taking them exactly as prescribed, it can directly lead to relapses, new complications, and ending up right back where you started in the hospital.
Okay, so let's get specific then. Why are these meds prescribed after discharge? Even if you feel okay, what are they actually doing?
The sources outline several key jobs they have. So if you had an infection, the antibiotics are there to clear it up completely.
Right, finish the course.
Exactly. Stopping early is risky, and it can even lead to drug resistance, which makes future infections way harder to treat. Painkillers, obviously, help manage discomfort while you heal, but they have their own specific rules too.
And what about for people with ongoing conditions, like diabetes or blood pressure?
Yep, crucial point. Meds for chronic conditions like high blood pressure or diabetes need to be managed consistently. Even if your hospital stay was for something totally unrelated, supplements might be there to help recovery or fix deficiencies. And for certain surgeries or conditions, you might need specialist meds for a set time. And importantly, the sources point out that a lot of post-discharge meds, especially for things like heart conditions or stroke recovery, are vital for preventing future events, potentially fatal ones.
Okay, the risks are clearly severe. So besides just stopping altogether, what are some other common slip-ups people make with their meds after discharge?
Well, there's that classic trap of stopping when symptoms get better, letting the underlying problem flare up again. Another is misusing those as needed meds, maybe taking them every day without checking if that's right, which could lead to side effects or even overdose. Restarting old prescriptions without talking to a doctor, that's dangerous because of potential interactions with your new meds, and trying to, adjust the dosage yourself.
Playing doctor at home?
Yeah, basically. That can easily lead to undertreating the problem or causing brand new issues.
It really does sound like a minefield if you're not careful. So what are some practical, actionable things people can do to manage their medications safely and effectively once they're home?
The sources offer some excellent, really concrete advice. A top recommendation: use a 7-day pill organizer.
The little plastic boxes.
Exactly. Just seeing everything sorted out visually makes it so much easier to keep track. Using technology is also key. Set alarms on your phone for each dose.
Good idea.
Maybe even label the alarms with the drug name so you know which is which.
Or, like you said earlier, tie it into your daily habits, maybe.
Perfect example. Take your morning pills with breakfast, your evening ones when you brush your teeth. Something routine. Another good tip was creating a simple medication map.
A mount.
Yeah, like a visual guide. Shows each drug, what it's for, the exact time to take it, maybe a note about possible side effects. And always, always keep an updated list of your current meds with you.
Like in your wallet or on your phone.
Exactly. Wallet, phone, somewhere accessible.
But the absolute core habit, it sounds like, is just consistency, isn't it? Take every single dose on time, exactly how they told you.
That's the foundation. And the sources add a few more important points. Never share or swap medicines with anyone else.
Right.
Refill your prescriptions before you run out so there's no gap in treatment. And importantly, know why you're taking each drug. Don't hesitate to ask your doctor or pharmacist to explain it simply.
Yeah, understand the purpose.
And keep an eye out for any unusual side effects, drowsiness, rashes, swelling, anything that seems off, and report it right away.
This is all fantastic advice for when you're actually at home. But what about that critical moment just before you leave the hospital? What questions should you absolutely make sure you ask your doctor or nurse?
Oh, this is so crucial. The sources give a really vital checklist. Before you walk out that door, you need to ask, which specific medicines must I keep taking at home?
Okay.
For how long should I take each one? Is it a week? A month? Indefinitely? Should I take them before or after meals, or does it matter? Any specific food instructions?
Good one.
What specific side effects should I be watching out for with each medicine?
Okay.
And a practical one. Are generic versions available if cost is a concern?
That's a really important one, too. And didn't the sources mention a couple of extra requests that are really helpful for clarity?
Yes. 2 key things. First, make sure you get a written list or a printout of your discharge medications, and it needs to have very clear timing instructions.
Not just handwritten scribbles.
Right. Clear instructions. And second, ask the doctor to actually write the purpose of each medication right next to its name on that list. This is for blood pressure, this is the antibiotic, etc.
Ah, that context makes a huge difference.
It really can. Avoid so much confusion later. Don't leave until you feel totally clear on all these points.
Okay. But what if you do all that, you get home, and things they don't feel right?
Yeah.
What are the red flags, the warning signs that mean you need to call the doctor immediately?
Yeah, the U.S. source highlighted some symptoms that definitely need urgent attention. Any difficulty breathing or sudden swelling could be an allergic reaction.
Okay.
Serious. Definitely. Confusion or severe dizziness.
Yeah.
Uncontrollable nausea or vomiting that just won't stop. Developing a rash or any unusual bruising. And critically, if those original symptoms that sent you to the hospital in the first place start getting worse again, that's a major red flag.
Those are really critical signs to know. And we absolutely have to talk about the role of family and caregivers here, especially for patients who might be older or maybe have memory issues or are just feeling overwhelmed.
Absolutely essential. The sources really emphasize this. Caregivers are vital partners in this process.
How could they help specifically?
They can help set up reminders, pre-sort medications into those pill boxes we mentioned, use apps or alarms. They can help read the labels and instructions clearly. It's also really important for them to monitor for changes, subtle shifts in the patient's mood, their symptoms, their behavior, and then communicate with the doctor or nurse if anything seems off.
Be the extra eyes and ears.
Exactly. One source put it very directly. Discharge patients may forget. Caregivers must remind. It really underscores that it's often a shared responsibility.
That's a powerful point. Okay, one last practical piece, cost. It's a reality. It can be a huge barrier for some people getting the meds they need. Any tips from the sources on managing medication costs after discharge?
Yeah, the U.S. source had several suggestions. You can ask your doctor or pharmacist about getting 90-day prescriptions through mail order. Sometimes that's cheaper.
Okay.
Always ask if a generic version is available and suitable for you. Look into manufacturer discount programs. Sometimes drug companies offer assistance. And for folks in the U.S., there are resources like price comparison tools online that can help you shop around for better prices.
Good to know. And there was that one really clever kind of specific pro tip tucked into the sources too.
Oh, yeah. The photo trick. Before you even leave the hospital, take a quick photo on your phone, get your discharge medication list and your hospital wristband in the same shot.
Why the wristband?
It creates a clear, time-stamped record of your official instructions, linked directly to your hospital stay. It can be invaluable if there's ever any confusion or questions later about what you were actually told to take.
That is genius. So simple, but potentially so useful. Okay, so this whole section, it really feels like it's about empowering you, whether you're the patient or helping someone else, with the knowledge and the tools to navigate that post-hospital recovery safely.
Exactly.
It's about turning that potentially confusing stack of papers into a clear, manageable action plan.
Precisely. And maybe reframing how you think about those medications, not as a burden, hopefully, but as the essential continuation of the care you got inside the hospital. Like, the invisible stitches holding your recovery together.
Invisible stitches. I like that. Okay, so pulling everything together now, we've looked at the institutional side, that commitment to quality and safety through accreditation bodies like JCI and NABH, setting those high standards inside the hospital walls.
Right, the foundation.
And then we've really dug into the absolutely vital personal commitment required after you leave, focusing hard on medication adherence as just a key driver of recovery and safety.
Yeah, and what's interesting, thinking about how these connect, is that while accreditation sets that strong foundation inside, the sources don't explicitly say, if a hospital is accredited, their discharge medication process will automatically be perfect.
Okay. So there might still be a gap there.
There could be. Or maybe the focus of accreditation is slightly different. You'd hope and expect that a hospital committed to high internal standards would also excel at discharge planning and patient education.
Yeah, it feels like there should be a logical connection.
It does. And the fact that you see companies like Supreme Medic involved in both accreditation support and providing patient information, like the Lifelines content we saw, it does hint at this broader ecosystem that is trying to connect these dots.
Right, like they see the whole continuum.
Exactly. And when you look at other related services mentioned in the sources, things like chronic disease management, specialized care programs, it reinforces that idea. Healthcare is increasingly seen as this ongoing journey, extending well beyond just the hospital stay.
So quality has to follow the patient home, basically.
That's the goal, yeah.
Okay, so we started by looking at those rigorous benchmarks hospitals aim for, striving for top-notch quality and safety inside their facilities. And we've ended up discussing the crucial actions that you as a patient or maybe as a caregiver have to take once you're outside those walls to make sure that quality care actually translates into a successful recovery.
It really highlights that the best results happen when the system does its part well and the individual is empowered, educated, and supported to do theirs.
Which kind of leaves us with this final thought for you, the listener, to chew on. If a hospital achieves the absolute highest standards of care within its walls, gets all the accreditations, top marks, but patients still struggle to maintain their health journey once they leave, maybe because of challenges with medication or follow-up or just confusion, how much of that hard-won institutional quality is truly being realized in the end?
That's a great question. How can we sort of collectively ensure that those critical steps taken at home, those invisible stitches, are given just as much priority and focus as the standards met inside the facility?
Something to think about. How do those big standards we talked about connect to the practical realities of care after the hospital, whether it's for you or someone you're looking after?
Definitely food for thought.
Thanks for diving deep with us today.